So Bodytite is a piece of invasive body contouring from InMode Aesthetics. Only physicians can perform the Bodytite procedure, and it's usually followed by manual liposuction. For the Bodytite, we do provide this procedure here at Plaza Aesthetics and Wellness. We have a surgical suite, sterile surgical suite set up in the back for our patients. When patients come in for an initial consult, we determine if they are an appropriate Bodytite or body contouring, invasive body contouring candidate. So candidates we ideally would like with a BMI less than 30. We can treat up to a BMI of 35, and that's at my discretion. We would do an extensive history to make sure this is an appropriate procedure and there's no contraindications. And then I would also do an exam to make sure that patient has the appropriate morphology, or whether it be fat cell destruction or skin tightening that they would like to use the Bodytite procedure for. So the Bodytite, where it is effective and where we see it on the market, is for skin tightening, but also body contouring, fat cell destruction. So I do have the little handpiece here. This is the handpiece that goes inside the body. So this is our probe. This heats up to about 68 degrees Celsius. So this gets very, very hot. This will kind of coagulate and emulsify the fat, which will then suck out with the liposuction cannula afterwards. And then this external probe, this goes externally on the skin, and this gets to about 38 degrees Celsius, so also very warm. So this is one of the reasons that you're going to see, for most of our patients, we say about 50% in fat cell reduction and 50% skin tightening improvement, because this is a much more invasive procedure. So day of procedure, we bring patient in, make sure they sign all the consents. I do prescribe them medication, an antibiotic, something to kind of calm them during the procedure, something for pain, and then also is for nausea. We mark up the area, so I go in and make sure that I circle the area of their concern. We talk about where we are going to, the areas that we're going to use for entry sites, make sure the patient agrees with everything, and then we just kind of let them hang out for a few minutes. We set up the area in the back. If we're treating an abdomen, which is one of the most common areas that we treat with Bodytite, we will often use 3 port sites. Usually the initial 2 port sites are kind of in the groin area, and then we use a 3rd port site at the umbilicus or the belly button. So for this procedure, we use a little bit of lidocaine to numb where we're going to make the ports. I make the ports with a scalpel, and then we go in and have a cannula where I'm going to infuse lidocaine. So the lidocaine is placed into a large bag with IV fluids, and based off of a patient's weight, we determine the appropriate amount of lidocaine that is safe for them. So lidocaine toxicity is very real, and we want to make sure that we're using a significantly less amount of lidocaine than is at the patient's max dose. We make sure that the patient's very numb. We go in and kind of open up the area with the cannula, so it's easy to then put in the Bodytite probe here. And we make sure the patient remains comfortable through this. If a patient needs frequent vital signs, we can do that. And then we start with the Bodytite. So again, this probe is inserted internally, and then we have the external probe. And this is where we get the maximum result when we have very hot energy internally and externally on the skin.